just tuned into the NAHO YouTube channel. Today we're speaking with National Aboriginal Health Organization Chief Executive Officer Dr. Paulette Tremblay. Dr. Tremblay is here with us today to announce NAHO's coordination of an exciting new initiative that will benefit First Nations, Inuit, and Métis children. Hello, Dr. Tremblay. How are you today?
Hi there, Colleen. I'm just great. Thank you very much. It's with absolute delight that NAHO announces the launch of the Aboriginal Children's Circle of Early Learning, and we call it ACCEL. This is a bilingual web-based network. It deals with the early childhood development of First Nations, Inuit, Métis children. The intent of the site is to identify and respond to emerging needs of First Nations, Inuit, Métis children and families. The site is to provide opportunities for early childhood service providers to access information on promising practices and current research. The site features the following kinds of resources, things like healthy living activities, educational games, directories for service referrals. There are tools for early childhood workers, and there's much, much more. It's a great site. You have to visit it and look at it and walk through it. You can do this by going to the NAHO website, www.naho.ca, and clicking on the link for the ACCEL site.
How was the ACCEL site developed?
It was built on the past work of the Canadian Child Care Federation, also the First Nations Child and Family Caring Society of Canada. It was originally launched in 2004. NAHO staff updated the look, feel, and infrastructure of the site, and we're now coordinating it to make it available and accessible to all people across Canada.
Why has NAHO decided to take on the coordination of this website?
A number of reasons, one of which NAHO identified First Nations, Inuit, Métis specific information on early childhood development as a priority. There was also a lack of culturally relevant information available for First Nations, Inuit, Métis children. Furthermore, NAHO's mandate is to improve the health and well-being of First Nations, Inuit, Métis individuals, families, and communities by using a knowledge-based initiatives.
You mentioned a lack of culturally relevant information for First Nations, Inuit, and Métis children. What evidence is there that demonstrates this gap?
Well, according to the Statistics Canada 2006 census data, there is a young and growing First Nations, Inuit, Métis population in Canada. It's the fastest growing population in the country. And because of this, investments in these children are of the utmost importance at this time.
Who do you anticipate will use this site?
There are more than 1,500 people who work in early childhood development programs in First Nations, Inuit, Métis communities across Canada. So we're trying to target that audience. Also, ACCEL is intended for childcare workers, nutritionists, teachers, elders, parents, that work with First Nations, Inuit, Métis communities and children, but also others, because it's a good information resource for them.
How will early childhood educators and service providers benefit from using the ACCEL website?
Well, individuals will be able to access information on promising practices and current research. There will be culturally appropriate solutions for First Nations, Inuit, Métis children and families, because there's lots of information on the site, and there are news and resources in a user-friendly format. It will also help individuals connect to other service providers, external sites and links.
In what other ways does NAHO support First Nations, Inuit, and Métis children?
Well, the First Nations Center of NAHO recently released Our Healthy Journey. This is a children's book, and it has it's based created by First Nations children for all children, and it introduces children's perspectives regarding health. It's a really phenomenal piece of information, and you can find this on the website also, and we will mail it to you. It is a book that children gave their perspectives about health, and it's been divided into seasons and themes, And it's a terrific tool that can be used by educators, health practitioners, families, and communities. And the children love it. And it's in their words, their pictures provide their messages. It's just a fabulous tool. This encourages healthy lifestyles that reflect First Nations cultures.
Is there anything that you would like to add today?
Two things: that there's a great need for caregivers and early childhood educators to have culturally appropriate information so that they can make wise decisions and provide the best opportunities for the growth and development of First Nations and Inuit Métis children. Also, and finally, this promotes a positive and lasting impact on First Nations Inuit Métis children. So NAHO is absolutely delighted to be able to launch the ACCEL website. We hope everyone will access it and use it. Yeah.
Thank you.